Megan.
And my name is Renee, and we're presenting our scholarly showcase on improving adherence to COVID-19 precautions among future healthcare professionals. Why we selected this topic. COVID-19 is a very predominant issue and has drastically affected everyone's life this past year, including the hospitals. According to the CDC, there has been 30.3 million total cases and 550,169 deaths in the past year alone. We thought it was very real and some benefit would come from choosing this topic for our senior capstone project. We wanted to educate healthcare professionals, specifically to improve adherence to COVID-19 precautions. Hospitals hit hard across the nation with COVID-19 cases, and our generation has never experienced a pandemic quite like this before. We weren't prepared for how to deal with it. With time, we've learned how to take to minimize the spread. There's also been a huge economic impact that will continue to affect our everyday lives for years to come. There's an estimated financial impact, $202.6 billion in losses from COVID related to America's hospitals and healthcare systems from March 8th to June 30th, 2020, average of $50.7 billion per month.
Our question. The question was asked in fundamental nursing students, does educating about the benefits of social distancing, masks, and vaccinations improve their willingness to adhere to these precautions? We use this PICO question to guide us throughout our research study.
Literature review. To gather information regarding our topic, we use CIL, the peer-reviewed search engine, to gather articles related to our topic. Keywords used in the search were COVID-19, pandemic, procedure, transmission precautions, masks, and vaccinations. We also gathered current recommendations from the FDA and the CDC. After collecting our articles, we evaluated each article using a table that analyzed the design of the studies, the variables, outcomes, and the recommendations based off their findings. Using this table helped us separate the information we were gathering and the rate and level of evidence of each article.
Our education project. After we completed our literature review, we created an educational project. We created a PowerPoint that we presented to an accelerated fundamentals nursing class. Before presenting the information, we administered a pre-test survey to determine students' current stance on adhering to implemented precautions. The pre-test asked questions to determine the students' current likeliness to adhere to social distancing, masks, vaccinations, hand washing, and educating the community. After administering the pre-test, we presented the information that we found while conducting our research. We presented the benefits of social distancing, masks, vaccinations, and hand washing. After the students received the information, we administered a post-test survey that asked the same questions as the pre-test survey. We used the two surveys to compare the results and determine whether the students' stance had changed after receiving the educational presentation. Our results. After presenting our educational PowerPoint, we analyzed the results. We learned that this educational PowerPoint indeed was successful in improving adherence to COVID-19 precautions. The students' likelihood to receive the COVID-19 vaccine increased 22%. The likelihood to adhere to mask wearing increased significantly after education about N95 respirators, surgical masks, and DIY face masks. Prior to receiving the education, 77.9% of students stated they'd likely wear a mask in big social gatherings. After receiving the education, 88.9% said they'd likely wear a mask in big social gatherings. Similar to masks, social distancing adherence also increased. More than half the class stated that they would likely adhere to the social distancing guidelines that were in place. After learning about the 5-step hand washing technique, students also very likely were to likely adhere to the precautions increased by 22%. Finally, the likelihood of educating our community about the measures we presented increased by 55.6%. This is extremely reassuring to know that our future healthcare workers are willing to provide education to our community about the important precautions. Through them, we'll be able to educate at-risk communities about COVID-19 and measures that they can take to decrease the risk of infection.
What's next? Through our research, we discovered that people who were directly educated were likely to adhere to the safety precautions recommended by the CDC. With the results found, we recommend direct education of at-risk population groups. These groups include people that do not have proper access to CDC guidelines, whose opinions are easily swayed via social media, and those who believe false information presented to them.
What's next continued. How can we get involved to directly educate at-risk populations? Targeting education to at-risk communities is essential, and ways we can provide direct education to at-risk populations include presenting free information that is unbiased and from a credible source. Ways we found to be effective would include presentations open to the public that are free of cost, giving information that is easy to read and easy to understand, and hosting general Q&As to help debunk misinformation that was spread about COVID-19.
And here are references that we were using, and thank you for watching.